super prepared to respond to. How do you think that you're leaving the state of things as you leave?
COVID, avian flu, Mpox, you name it, we've had to deal with it, and it's tough being ready because it costs money to get ready. And so those are the things I fear most. What one person, what one department, as big as HHS does not going to change what that virus and what that cyber attack can do unless they're not prepared. And if you're prepared, you can be the most equipped to handle it. And I would just hope that whoever is going to try to run the 12th largest budget in the world understands that there's a lot of responsibility in your hands to ensure the health and well-being of Americans and, quite honestly, people around the world. When someone says, make America healthy again, I would say, been there, done that. That's been our mantra moving forward. We've been working to promote health, and again, not just repairing illness, but promoting wellness. $700 million shots have gone into the arms of Americans for COVID. We've never had an adult vaccination program of that magnitude ever before.
Did we cover everything you wanted to
Yeah, no, this was great. It was very, very insightful, and
We didn't even get into infant one, how we became the distributor of infant one.
We talked about the record-breaking success we've had in getting Americans covered, which, by the way, if you have more than 300 million Americans with health insurance coverage, that means you have fewer Americans, record low number of Americans who have no access to health insurance, uninsured, which dipped below 8%, got to about 7%. No president has done that before in the history of the country. We now have 24/7 critical care centers for mental health services and substance use that were not around before. Because before, more often than not, because even hospitals weren't good at this, is you had to go between the hours of 9 to 5 to get your mental health services. You don't always have that mental health breakdown at between 9 to 5. Well, same thing's going to happen if you've got at the top people who are dismissive of vaccinations or are antagonistic, I'd say, towards vaccines. It's tough for all the reasons I mentioned before to get people to trust something that they're not familiar with. They haven't had a chance to touch and feel it. Now if you hear people who are supposed to be giving you good guidance on what to do, telling you don't do it, or it may not be good for you, it's going to be tougher. So I hope that what we have is leadership driven by the science, leadership driven by the experts, leadership driven by the people we trust to tell us how we can best keep our families healthy, because we don't have the luxury of dropping our job, dropping our kids, dropping our work at home to do the science behind those vaccines.